Hello guys, let us study in this video about Declaration of Helsinki. So, Declaration of Helsinki is a comprehensive statement of ethical principles. It might be for all the medical research involving the human subjects. So, in whichever research the human subjects are involved, this is the declarations that they have to follow. It is mainly developed by the World Medical Association. It was first adopted in the year 1964 and has undergone several revisions and hence changes have been made, and the recent version was adopted in October 2024. So coming to this, what this Declaration of Helsinki mainly involves. First, I'll give you just brief introduction about it. Set the purpose and the scope of declaration. It will emphasize the ethical obligations, that means what is right, what is wrong, all it will be telling. To all the physicians whoever are undergoing a medical research or undertaking any medical research. Second thing is general principle. What principle it will involve? First of all, it will describe the ethical foundation, which includes the respect for individuals, right to make informed decisions, protection of life, health and dignity and privacy of all the participants. Then affirm that the well-being of the participant must be precedence over the interest of science and society. So all these protections are important whenever you go through any medical research involving human subjects. Next thing is the risk, burdens and the benefit. Whatever research you conduct, then it should minimize the risk and the burden, I can say. Be preceded by risk-benefit assessment. That means the risk and benefit assessment should be done before undergoing any of the study involving human subjects. Next is we have to be conducted only if benefit overweighs the risk. We can conduct the particular research. It is declaration of this Helsinki. And the next is vulnerable groups and individual section. Under this, what all they want the researchers to do is, first is defines. It will mainly define the vulnerable population. Vulnerable population, as I said in my last video, is mainly the children's, the mentally ill patients. All those come under this vulnerable groups. Proper specific justification and protection measures for involving them in the research should be set whenever you are doing any research. The next thing is specific requirements and research protocols. So under this section, what this declaration says, let us see. Research must be based on scientific knowledge and methods which is to be used. Next is we need to use a detailed, ethically reviewed protocol. And third thing is clearly it should be described all the ethical considerations. So everything is important whenever you carry any clinical research process. Next thing is that research ethics committee. So all researchers must be reviewed and approved by independent ethical committees before beginning any of the research. And committees must be transparent and independent. That should be the main character of any of the research. Next is privacy and confidentiality. So all the research should ensure respect for privacy, protection of personal data and confidentiality. Informed consent. So informed consent must be voluntarily and based on full understanding. The patient has to be taken their informed consent. And another thing is should be given in writing if possible. And participant can withdraw at any time without any consequences. So that right should be there for all the research participants. Next is coming to the section of use of placebo. Placebo use is acceptable only when there is no proven intervention exists. That means no prior medical treatment or method is proven that can tackle the particular medical condition. So this means that, or for compelling scientific reasons and participants are not at a risk of serious harm, then only you can use the placebo. Coming to this last section is post-trial provisions. So participants should have access to beneficial interventions identified in the study, and they have to have access to this benefit. And research registration and publication. All the researches that is conducted must be registered in a publicly accessible database, and results should be published regardless of the outcome. You should not see that you should not set your outcome before you do any research, that this outcome only I have to have and I have to make my research according to that outcome only. No. whatever you have, the results should be published regardless of your outcome. And negative and inconclusive results are also important some of the times for further researchers or the further research to be done. Next thing is unproven intervention in clinical practice is the last section under this Declaration of Helsinki. So it mainly allows the use of unproven interventions only in the patient's best interest, with informed consent it has to be, and with the intent to evaluate them scientifically. So these are all the things that researchers must keep in mind before they conduct any of the study, and these are the ethics that they have to follow and carry on all the researches, that is including any human subject. Thanks for watching the video. This is all for this video, and next video maybe we will come up with some new topics in the research field. So thank you, keep watching, stay tuned.